Welcome to my YouTube channel. If you're new to this channel, please subscribe and turn on your notification bell so you're gonna know whenever I drop a new video. And to my returning subscribers, you guys are the best. Have you been asking yourself the following questions? How can I calculate my cycle? When am I safe? When are the right days to have sex in order to conceive? Today, in this video, I will be answering all these questions. Make sure you watch till the end of the video. I'll be right back. Welcome back. Let's start by knowing what menstruation and menstrual cycle is. Menstruation is the monthly shedding of the lining of a woman's uterus, commonly known as womb. So, each month during the years between puberty and menopause, a woman's body goes through a number of changes to get it ready for possible pregnancy. This series of hormone-driven events is called the menstrual cycle. During the menstrual cycle, an egg develops and is released from the ovaries. The lining of the uterus builds up, that is thickening of the uterine walls. If a pregnancy doesn't happen, the uterine lining sheds during a menstrual period. And the cycle consists of 4 phases, which are menstrual phase, follicular phase, ovulation phase, and luteal phase. I'm not going to explain deeply because I'm going to talk about that in my next video. The menstrual cycle begins on the first day of your period. The average cycle is 28 days, but cycle can range from 21 days to about 35 days. So let's explain the phases. The menstrual phase now starts from day 1 to day 5 or more in some people, when the lining of the uterus is shed out through the vagina. Some people, it is being shed out through the palms and eyes. It's kind of rare. Second one is follicular phase. It starts from day 6, the 6th day to 14th day. So the ovaries produces follicle that contains immature eggs. So as from day 10 to 14 day, one of the developing follicle will form a fully mature egg, that is ovum, in this follicular phase. So ovulation phase starts proper on 14th day, the 14th day in a 28 days menstrual cycle. The ovary release its egg, that is the mature egg. So the luteal phase now, it starts on the 15th day to 28th day. So after the follicle now releases its egg, as we all know, it changes to corpus luteum. The structure, it releases hormone, mainly progesterone and some estrogen. So the rise in this hormone keeps the uterine lining thick and ready for a fertilized egg to implant. If fertilization occurs, if the person gets pregnant, your body will produce human chorionic gonadotrophin, that is HCG. This is the hormone pregnancy text dictates. It helps maintain the corpus luteum and keeps the uterine lining thick. But if you do not get pregnant, the corpus luteum will shrink away and be reabsorbed, and the decreased level of estrogen and progesterone leads to the shedding of the lining of the endometrium, which then causes menstrual flow, that is your period. So let's enter into the calculation proper. The red icon stands for menstrual period. The yellow icon stands for favorable period to conception, and the other one stands for your ovulation. If your period starts on the 2nd of March. Let's use this calendar because it has symbols that will be used in calculating it so that you can understand it. So if your period starts on the 2nd of March, or let's just say on the 2nd of this month, and it lasted for 5 days, which is 6 now, starting from 2nd, 3rd, 4th, 5th, 6th, which is 5 days. From 7, 8, 9, 10 are your free period. For you to calculate your fertile days, the days you can conceive, your fertile period, which is your ovulation, you have to count 14 days from the day your menstruation started, which is 2nd. So let's count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So 14. The 14 days fall on 15th of March, which is your ovulation, the most fertile period, which when you have sex, you conceive straight. No question, no doubt or question about that. But studies have shown that 2 or 3 days before the ovulation day and 2 days after are very risky, are favorable periods for conception. So for you to calculate your menstrual cycle, to know if it's 21 days, 28 days, or it lasts up to 35 days, cycle means when your menstrual flow comes out and when it comes out again, from the last menstrual cycle to the starting of new one. That is what cycle means. So we are going to find out how to calculate it. So we are going to be using 28 days cycle because it's the average cycle. So if your period started on 2nd, so you are going to count 28 days to know when your period will come out. So let's start from 2nd. We are going to be counting from 2nd. From 2nd to 3rd is 1 day. 4th day is the 2nd day. 5th day is the 3rd day. 6th is the 4th day. 7th is the 5th day. 6th, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 21, 22, 23, 24, 25, 26, 27, 28, which falls on the 30th of March. That is, we used 28 day cycle to calculate it. So the next period starts on 30th. So let's recall what we said. We talked about safe period are those periods you will have sex and not conceive. Ovulation period are those days you will have sex and conceive. So the 14th day is the ovulation period. 2 or 3 days before and after ovulation are very risky or are favorable days for conception. If this video has been of help to you, why not subscribe, like, share, comment, and turn on your notification bell, because we got more of interesting video made easy just for you.